Good afternoon, everybody. This is Jim McDaniel at URL Insurance Group, and I want to thank everybody first for coming and joining us today on this brief overview of our newly launched website and some of the tools and features that you as a producer with URL can access. I also have Sarah Ortega here with me, our marketing and advertising assistant, who's going to go over some of the different parts of the website as well. This webinar today is going to cover the MyURL section of the website and how you can go about seeing some of your submitted cases, what your contracts and writing numbers with URL are, how you can check on your current trip points, and I'll also go over some of the different quoting tools that you have access to by logging into our site. Sarah is going to cover the event calendar, the community section of the website, and some different means and methods of being able to contact us through the site. So to start off, I'm going to log into the site, which you can do from the home screen. Everybody that has access to our site, your username is your email address, and I'm going to use a demonstration account here that Jim Adelsberger and I set up. So everybody's login is their username, or everybody's username is their email address. And your password is the first letter of your first name, your entire last name, and the last four of your Social Security number. For example, mine would be J. McDaniel 1234, if that were the last four of my Social. So that is how you can get into the site. You can always, if you forget either one of these, you can use the forgot your password or forgot your username, and we'll send that back to you in an email. But I'll go ahead and get logged in here. And once we're logged in, it'll say, hi, welcome. And then from there, you can proceed to go into the MyURL section, which is the first kind of area I'm going to cover. You can get to the MyURL area from up here at the top of the web page. You can click on the MyURL button, or once you log in from the home screen, you can get to it from here. Either way, it all takes you to the same place. All right, and this is the MyURL page. From here, the first thing we'll look at is how you can check your cases. So you come in here, click on Check My URL Cases. If you have a bunch of cases, it may take a second or so for the report to run, but this one came up pretty quickly. So once you get in here, you can see the type of case that was submitted, the plan that you sold, the policy number associated with that case, date entered, premium, effective date, etc. From the top area up here, you can go and some of you that have a lot of business with us, there'll be hundreds and hundreds of records here. So you'll want to use these areas at the top to narrow those down. And you can obviously sort by what kind of case type it was, the status, see them all, just show pending, issued, etc. If you're looking for a specific date that a policy was issued or whatever, you can sort it that way. Or if you know what carrier you'd like to see, they are all listed here that you can sort by that as well. So once you're in,
Welcome to GoToWebinar, web events made easy.
can you guys hear me okay now? Give me a thumbs up if you can hear me all right. I had a little technical difficulty here, and we should be hearing me through the computer. We're all right? Okay, great. Thanks, everybody. I don't know what happened there, but I started hearing myself through my phone. So once you're logged into here, into the MyURL, and you go to your checking your cases, you can click on the case name, the opportunity name, and from there it'll give you even more information about that client that you sold a case to. So if you click on that, it'll pull up, and this is just dummy information that we've entered here, but in this, if we have that information on your client, it would be in this area. So it would show the client's phone number if we have it, if we have their email, what their address is, and kind of a little more in-depth information on the case. If we go back to this, we'll say that you wanted to pull down all the cases that you've written with us to import into your CRM system or however you keep track, or you just like to see it in a spreadsheet, if you click Export to Excel, that's going to open up a spreadsheet that'll download. And then from within here, you can see all that different information. And these would not be our address. These would be your client's information in here, and kind of all that in a spreadsheet. So if you use some kind of CRM system, you could easily modify the spreadsheet a little bit to import into your system for your records. And that's pretty much it on the URL cases and some of the things you can look into there. The second thing we're going to look at is contracts. And this is where you can go and see what contracts you have with URL and what your writing number is and when that became effective. One thing to note in this area is that just because it's listed in here that you have a writing number with a specific carrier, it's possible that it may not be active anymore. We're not always notified when terminations occur, and it could be that when your contract was active, that writing number was accurate, but some carriers will terminate you if no production for a certain amount of time, etc. But this would, if you write Foresters every month or every week or whatever, you're gonna be pretty sure that's an active number. And obviously, if you saw something there that you had a question on, we could research that further for you and make sure that that's accurate. But these writing numbers will be accurate. The date that the contract started will be accurate. You can also export those to Excel just as we did with the case summaries. So this is where you can see your carrier contracts that you have with URL. The other area that you can look at to get some kind of custom information from within MyURL is your trip points. So if you go into check my trip points, it'll run the report. Over here you'll see the different premiums in order to get 1 point. And over here on the right, it'll show, based on your pending business, what your points are, and then business that's went to paid, what those points are. And usually those will be the same, but it's possible one could be still pending and not paid, and then that number would be a little different. So that is the trip points area. One thing to note, the commission area here, that goes into our commission system. That's at this point really is just for some of the Medicare Advantage and the health carriers that we pay. You will have a separate login to get into that, and part of our enhancements coming down the road is a single sign-on. So once you would log into MyURL, you would be able to go into those different parts of our commission system, lead force, the health quoting tool, without having to log in again. But unfortunately, at this point, that's how it works. The trip points here, if you are familiar with our trip, under rewards and incentives, you can that would be calculating trips for this 2014 trip. The other part of the site that I'm going to go over, which can be accessed through MyURL, either there or here on the screen at the top, is the quoting tools. And each department kind of has their own different type of tools that they use. The annuity, it doesn't really actually run a quote, but they have a form that you can come into here, request an annuity quote. Come into this this form, and you fill out as much information as you have, hit submit, and that'll be sent over to Joe and his department, and they'll get on working up an annuity quote for you. The other request for a proposal on the annuity side is a single premium life. And it's a much shorter form, but similar type questions. You go through, submit that gets sent over to Joe and his team, and then they get on getting a proposal together for you. On the health quoting side, we have the Health Private Marketplace Quoting Portal, which we work with our partner Ebix Health Connect, and they supply different quotes that you can come into here, and there is a separate login for the health side, but that's something that we're looking to have a single sign-on situation coming down the road. If you haven't used this, you'd want to register, or if you do and forget your password, obviously you can reset that from here, or give us a call and we can help you out with it. Another thing with the quoting portal, and many of our agents have done this, is you can purchase the quoting portal. If you have a website and you'd like to direct consumers to it, you can, for $55 a month, you can have this sit on your website. Consumers can come in and run quotes. They'll see the plans come up, and you can also generate quotes on the back end to send to your clients that they can apply online directly with coded links that would credit the sale back to you through each of the carriers. So that's the private marketplace quoting portal. Another tool that's on the health quoting side is the individual subsidy calculator, and this really just links to the Kaiser Family Foundation tool that you can go through and enter information to see what type of subsidy one of your clients would be eligible for through the health insurance exchanges. And then the fourth thing on the health quoting tools is the group census form. This opens up a spreadsheet that you would fill out with your group, and all the different information required to generate a group proposal, and then you can email or fax that sheet over to John Real here in our office, and then him and Elise will get started on a quote for you. Going back to the quoting tools, Life Quote, there's a couple different options here as well. You can run a term life and guaranteed UL quote, and clicking that link will open this up. This is since I've been at URL, this is month in, month out, one of the most popular pages on our site that a lot of people will go to and run quotes on. It's pretty good. It quotes at least 30 different carriers pretty quickly, enters some basic client information. You can help figure out the health class and different kind of riders and things that you would want to add, and it's pretty robust. Once you get past this, you can get forms from this, and we can actually spend a separate webinar just on this tool alone, but it gets a lot of traffic, and it's a good quoting tool. We also have, as kind of a quoting tool offering, again, kind of like the health quoting tool, this would sit on your website if you have one. It's a consumer life term quoting engine. It's kind of a lead generator. We have some agents that are currently using this. It is typically $30 a month. Since you guys are partners of ours, you can get it for $15 a month on your site. If you come in here, you can demo it. There's a video on it, and it would also come with kind of a microsite that would, your name goes here. You can run quotes. There's some YouTube videos down here on, why you should buy life insurance that would help your consumers. Just a lot of good copy, and for $15 a month, it's a really neat tool that can collect leads for you. And then also, if there's something custom you need, you don't want to run the quotes, you're not sure exactly what's needed, you can come in here to custom case design, and this is a form similar to what we saw on the annuity side, where you can go in when you need, the life quote, fill out all this information. That gets sent over to Matt and Steve and their team, and they'll get on working up a quote for you. And that's typically during normal business hours. It's 24-hour during normal business week, excluding the weekends, obviously. We get those back out to you in a 24-hour time frame. So that's really some of the new features that we've rolled out with this site, and some of the tools that are available to you as an agent. I'm going to now hand it over to Sarah Ortega, and she's going to go over the event calendar, the community section of the site, and some different ways you can talk to us.
All right, thanks, Jim. Hi, my name is Sarah Ortega, and the first thing that I'm going to show you guys today is the community section. Now, this is your source for insurance information, any upcoming events that we are having, and anything that may be going on at URL. Now, the thing that I think we get the most demand for would be the event calendar. And you've seen at various places around the site, we do have blocks that display the upcoming events. Now, an important thing to note is that all of our events are color-coded, and they're color-coded by department. You can see in the upper left-hand corner here that, if you only want to look at life, well, then you only have to look at the red. Now, that also becomes important because our calendar, if you click this arrow right above the month, you can sort by department. So if you only want to see life markets, well, that's all you have to see. So we usually leave these all turned on. You can customize that for your own use. So if you wanted to register for a webinar or learn more about it, you would just click on the event, and then it's going to open up a pop-up with all the event details, the way to register, if there's any external links that might tell you more about the product, and then you can copy it to your Google Calendar as well as to your Outlook. All right, the next thing I'm going to show you is the insurance news. Now we have multiple opportunities on our site for you to learn about different things. So there's the health reform news, and this is actually an archive of our HCR Essentials email that we send out every Thursday. If you've ever missed one, feel free to come in here. You can also search for different things. We list all of the articles that we talk about, and you just click on the link. It'll open up the newsletter so you can see it. At the top, we do have our weekly PPACA conference call. You can click to register, and then you can view the archive, at which point we do have recordings available. They are also available on our YouTube page, which you can just visit. On the side, there's a YouTube button. So then we have any breaking news that you might want to see. From reputable sources, we pull in. So at any point in time, just consider us your source for what's happening in the insurance world. We're here to inform you and give you what you need. We also have our newsletter archive. Now anytime a newsletter is sent out, we do update it here the same day. And so you would be able to click here if you ever missed one or if you wanted to go back and refer to something. The information is always available to you. We never get rid of it. So the next thing that we get asked a lot is, how do I contact you? Well, there are a lot of different options with the website on how you can contact us. The first being, in the lower right-hand corner, there's an orange button that says Live Chat. Now, when we're online, that will say Live Chat. When we're offline, it'll ask you to leave a message. Either way is a great way to contact us with any kind of general questions like, what are your hours during Thanksgiving? Are you open tomorrow? Those kinds of questions. And we will get back to you as soon as possible if we're not online, but we usually are. Now, we also have a Talk to Us button, and if you were to click that, it takes you to the contact form. You can also just go directly to the contact form if you'd like. This is a great way if you don't know specifically what department you would like to contact. Just fill in exactly what you need and we'll get it where it needs to go. Alternately, you could contact individual employees. The best way to do this would be to go to the phone extension list. You have your the phone number for each person, but then also at the very top there's a PDF. Now, we've received a lot of requests for the PDF because it's a great tool to just have on hand. Anytime you want to call somebody up, if this is printed at your desk, you can call them straight away. You don't have to get to the receptionist. You don't have to wait. It'll also have all of our emails on it, so if you need to contact anybody, this is just a surefire way to get through. So if you say you wanted to email me, you could click on my name here on the contact list, and it's going to take you to my company bio. And so here you can send me an email, you could call me, you could connect with me on LinkedIn, or you could download a V-card. Now, a V-card is actually a virtual card. It has all of my contact information. So when I click on that and I click Open, it's going to import all of my contact information into Outlook or my phone if I'm on my mobile phone. So at this point, it's now saved everything that you might need to contact me in the future. So at this point, I'm going to pass it back over to Jim. If you have any questions, go ahead and leave them in the notes.
Yeah, send them over any questions that you may have, and I can go over that. One thing that I failed to go over on the quoting tool, and I know Vince will give me a hard time for missing this one if I don't go back to it, is the senior quoting tool that I forgot to include in this presentation. So from within the senior quoting tool, you can run a Med Supplement quote, or alternatively you could run a Med Advantage quote. You can come in here, I'll put in some information, finds I'm in Harrisburg, and then I'm 66, get quote, and then you can kind of run through and you can filter them, you can print them and do different things from here on the Med Sup and Advantage quoting tool. So coming back to our home page, if you do a lot of your if you primarily do your business with URL, something that we have going on to the end of the month here, I'll just throw this out. We have our Eno coverage that's right now only $125, and that would cover you till October 31st of October 31st of 2014. It's a pretty great rate. At the end of this month, it'll go back up to 150, and then each quarter it kind of gets prorated down. So that's a good thing if that's something that would help cover all your business that you write with URL. Any questions on part of the site you'd like to see or anything else? I really don't have a lot of questions coming over, so I guess we did a great job. Again, I'm going to send a follow-up message out to this email. It'll have a link to the recording if you want to view it. It'll also be on our, as Sarah mentioned, our YouTube channel. We host all of our, we're starting to, at least the ones this year, we're posting all of them on our YouTube channel. You can go there and review any of the PPACA conference calls, past critical illness webinars, etc. Those will all be on there along with this one that I'll send out as a follow-up. So I certainly appreciate everybody's time today, and I hope that the new site can save you time and help you make more money. If anybody has any questions after this, please feel free to reach out to me, and I'm happy to assist. Thank you for your time. Have a great day.